Most large providers have multidisciplinary or interdisciplinary huddles at all levels of their organization, starting at the unit level with the care team and their managers, then escalating throughout management up to clinical leadership. These huddles are patient-centric and intended to focus on discharge planning with the goal of reducing the patient's average length of stay. Many of these huddles are done on physical whiteboards at each unit, which causes issues on reporting, follow-up, task management, and learning from how these issues are resolved. Also, the time it takes to data mine in the EMR to collect all the relevant information for these huddles is time-consuming and creates duplicative work. By creating a digital whiteboard, we can keep the provider's workflow the same, but automatically pull in and aggregate the data needed to prepare for the huddle. This allows the extended care team to focus on patient care instead of administrative work. A digital whiteboard can synchronize with your EMR with information such as patient census, location, primary diagnosis, and assigned provider. It provides an aggregate view of the necessary information about the patient's care so the care team can prepare for their discharge. The goal is to discharge the patient as quickly as possible, but as soon as they are medically ready. By using Microsoft's industry-specific data interoperability with your EMR provides real-time updates to this digital huddle board, care teams can focus on patient care while saving your organization money by reducing the patient's average length of stay.